Good morning, everyone. I'd like to convene our Public Health Committee meeting this morning in this giant room. Does someone need to mute their computer? Is that me? We all good? Okay. So today we will be JFing bills. We have a lot of great conversation ahead, I'm sure. I'd like to kick it off by turning it over to Senator Anwar, my good co-chair. Senator.
Thank you so much, Madam Co-Chair. Good conversations, very important bills in the pipeline. Looking forward to moving them forward for the rest of the body to weigh in on. Thank you.
Thank you so much, Senator. Representative Claridis Tetria.
Thank you, Madam Chair. Good morning, everybody. Looking forward to some healthy conversation.
I like how you did that, Representative Claridis Tetria. We, as you know, as Senator Summers joins us, I'll give you a moment, Senator. There are many meetings happening in the building today, and members will be moving in and out. We will be holding the votes open until 3 p.m. today, which I will repeat throughout the meeting, but just wanted to say that at the outset. Senator Summers, good morning.
Yes, good morning. I just want to reiterate, there's multiple meetings going on at the same time. So you will see people in and out of the committee. It doesn't mean that they're not engaged or wanting to be here. I think we have a PROPS actually at the same time. So I also will be running in and out. So hopefully we can get started. Thank you.
Thank you, Senator. It's always a good reminder. So with that, we're going to move right to item number 3 on our agenda, bills to be considered for JF action. Item number 1 is Senate Bill number 175, an act concerning funds for the Rare Disease Advisory Council. The action is to JF this to appropriations. May I have a motion?
So move.
Moved by Senator Summers and seconded by Senator
Anwar.
Is there discussion on this item? And actually, you know what, before we do that, I will just note that what this bill does provides $50,000 to the Rare Disease Advisory Council. And in addition, it allows the council to raise the ability to raise funds and use funds that are privately donated or otherwise acquired. So is there discussion on this item? Senator Summers.
Yes, if there's no objections, I would like to ask that we start a consent calendar and add this to the consent calendar.
Thank you very much. And I believe we need a motion for a consent calendar, or do we do that at the end? I'm looking at I'll take the motion now.
Okay, I'd like to make a motion to start a consent calendar. Thank you.
Thank you. Senator Summers moves that we begin a consent calendar, and Representative Claridis Tetria seconds that. So is there objection to moving item number 1 to the consent calendar? Seeing and hearing no objection, we will move that item to our consent calendar. Moving on to item number 2 on our agenda, Senate Bill number 243, an act establishing an assertive community treatment pilot program for home health agencies. This would be a JF to appropriations. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Seconded by Representative Ryan. This bill would be a pilot program placing 3 of the assertive community treatment teams with 3 home health agencies. Is there discussion on this item?
Through you, Senator
Summers.
Through you, Madam Chair. Maybe for people watching, you could describe what the community teams are. So that would be great. Thank you.
Thank you, Senator Summers. The teams are designed to be multidisciplinary teams who go out and work in home with people with serious behavioral health disorders and comorbidities. So again, those teams are multidisciplinary and really working closely together to help treat and support those who have some significant needs. Representative Claridis Tetria. Oh, excuse me. I'm sorry. Senator Anwar and then Representative Claridis Tetria. Thanks,
Sure.
Senator. Got to pay attention to the screen.
I'll just add to this. This bill is actually a complementary bill to looking at how can we make sure that the home health workers are safe. And there are multiple avenues and challenges associated with it. And during the public hearings, we were able to listen and to learn that if a home care nurse is going to identify an individual with the needs or condition changing we have to look at if they're in their home, and it does not automatically mean that everybody should go to the hospital. And there are intermediary steps that are there where various team of mobile crisis units or the ACT teams that have been created by DEMIS can intervene and help out in the process. So I think that's why this bill is going to show us an avenue to try and increase the spectrum of keeping the more patients in the outpatient setting rather than getting inpatient. So I think it's a good bill, which is going to help us look at the areas of opportunity. It's thinking outside the box and coordination and collective work. Thank you, Madam Chair.
Thank you, Senator Anwar, and I will do a better job of paying attention to all of you online. Of course, there are a number of our members joining us via Zoom. Representative Claritas Tetria.
Thank you, Madam Chair. Do we have any idea the cost of the pilot program?
I do not have that at my fingertips, and I will have to get that to you, Representative.
Thank you, Madam Chair.
Is there further discussion on this item? Seeing none, Madam Administrator, would you kindly call the roll? Oh, excuse me, before we do so, Senator Marks.
I apologize. So I just want to say that this is a wonderful bill, and it's really to ensure, as much as we know that having our home care workforce be safe, we also want to ensure that every patient who needs the care gets the care. We don't ever want to not be able to take care of anybody. Switch my glasses. So that is what this bill will help us to find the best way to do that. So thank you, Chair.
Thank you, Senator Marks. Representative Reddington Hughes.
Thank you, Madam Chair. My question has to do with, do we already have any teams in place?
Thank you, Representative. And we did hear testimony from the Department of Mental Health and Addiction Services, who provided written testimony as well, is that, yes, we do have these teams working. This would be to place them with home health agencies. Seeing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers,
Summers votes yes.
Representative Claritas Tetria,
Representative Claritas Tetria votes yes.
Representative Belton,
Belton votes yes.
Representative Burgess Givallo, Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Django, Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kidd, Representative Kennedy, Representative Linehan,
Linehan votes yes.
Representative Morrow, Representative McCarthy, Representative Palm, Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes.
Senator Slabb, Representative Steinberg,
Representative Steinberg.
Representative Terziak, Representative Wielander,
Representative Welander votes yes.
Representative Zupkis, thank you, Madam Chair.
Senator Rahman back here. I'm sorry. I think I missed.
Thank you, Senator.
Thank you.
Thank you, Madam Administrator. And again, I will remind folks that votes will be held open until 3 p.m. today. With that, we will move to the next item on our agenda, Senate Bill number 274, an act concerning opioids. This is a JF to the floor. May I have a motion? Moved by Senator Summers.
Second.
Second by Senator Anwar. This bill would add or codify a subcommittee to the Alcohol and Drug Policy Council regarding parents and caregivers facing substance misuse. It would also require Narcan coverage for patients prescribed an opioid at the hospital. Is there discussion on this item?
Seeing none,
Senator Summers?
I would ask that this be added to the consent calendar.
This item is being requested for the consent calendar. Is there objection? Is there objection? Seeing no objection, this item will be added to our consent calendar. Moving on to item number 4, House Bill number 5058. This is an act adopting the Nurse Licensure Compact. This is a JF to the floor. May I have a motion?
So moved.
Moved
Second.
by Senator Summers and seconded by Senator Anwar. This bill, though a JF, will remain an ongoing conversation. As we heard through testimony, there were a number of concerns that have been raised. We do believe that we have some good language potentially, which we'll be working on together with stakeholders to address the concerns, one, about privacy, nurse privacy, and the use of Haven. 2, the funding and financial viability and sustainability of funding for Haven, the fingerprinting and workforce reporting issues. So we will be continuing to work on this issue together with OPM, with our nurses and others. This bill is a bill to address our nursing workforce shortage, and I am open to discussion. Is there discussion on this item? I'm seeing Senator Summers to be followed by Senator Gordon.
Yes, I just wanted to talk about the fact that I know that there are still some questions concerning Haven Health and how we're going to make up some of the financial aspects of that. And this is a work in process. So if you're voting on this today, the language will certainly probably be refined as it goes through the system. So I just wanted everyone to know that we are aware of those issues and heard that loud and clear during our public hearing. Thank you.
Senator Summers, thank you for underscoring that. The language will certainly be changed. It absolutely will be. So what we're doing today is keeping this conversation going, knowing that we've made good progress and we expect to continue to make progress. Senator Gordon.
Madam Chairwoman, thank you. And I just want to highlight those points that even though I'll support this with the understanding that it is going to move it forward, certainly heard very much from Connecticut Nurses Association and our nursing colleagues. But again, funding for Haven, extremely important, the confidentiality, extremely important, and the scope of practice understanding for nurses who are in other states, understanding what they can and cannot do in Connecticut, very important. So I just want to highlight those key points. Thank you.
Oh, thank you, Senator Anwar.
Thank you, Madam Co-Chair. I just wanted to echo some of the things my colleagues have said, but also add to the fact that I wanted to thank OPM, Haven, all the Department of Public Health, and also our nursing organizations who have been working diligently to identify common ground. This is still work in progress, like you have stated, Madam Co-Chair. I would just say that if we cannot address the issues that we have talked about, there will be some concerns, but I know that we are moving in the right direction, and there's everybody is moving and aligning to make sure that all the smaller and bigger issues are addressed. So, of course, I'll be voting yes as well, like my colleagues, but we'll be watching this to make sure that we do the right thing for our nurses.
Thank you for those remarks, Senator Anwar. I echo them. I'm very grateful for folks trying to make sure that our nurses particularly caring for the caregivers who need the help and support of Haven, have the opportunity to do so in a protected way. That's really important to us. So seeing and hearing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Summers votes yes.
Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Burger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Django, Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Representative Cavers DeGraw, Representative Kitt, Representative Kennedy, Representative Lenahan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy, Representative Palm, Representative Pirello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Zupkis votes yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. And again, votes will be held open until 3 p.m. today. Moving on to item number 5 on our agenda, House Bill number 5196, an act expanding the podiatric scope of practice. This is a JFS to the floor, LCO 2866. May I have a motion?
So move.
Moved by Senator Anwar, seconded by Representative Clarice Detrier. The S language for this bill which is a compromise, and I want to begin by thanking those who have engaged in the conversation, which I believe will continue. So we have S language. We will probably need to make some additional slight changes to this, perhaps some technical changes. But I want to thank our orthopedic surgeons and podiatrists for coming together in conversation. We know from our hearing that this is a very lively discussion that has been happening for many years between these very important professionals who help us care for our feet and ankles. The S language will allow the forefoot and midfoot amputations by podiatrists to independently perform those. And they would need to provide documentation to the Department of Public Health that they have graduated from a podiatric residency program, meeting certain criteria, and hold current board certification or qualifications. And this is an accredited residency program, and I will take discussion on this item. I see Senator Summers.
Yes, thank you, Madam Chair. One thing that I would like to try to be clear on is I really see this as a work in process coming out of this committee. I don't think that the language is final. I think it's important, our current statute reflects where amputations can be done by a podiatrist from the toe to the metatarsal. And this would, or what's been agreed to, is being able to extend that amputation to the show parts joint. And I want to make sure that that's reflective in the language, as well as a continuing conversation going forward, because I am somebody who believes, especially now that our podiatrists graduating from a accredited school, one in New York in particular, there's a school that just does podiatry. You're a doctor of podiatric medicine. All you do is the ankle and the foot. And I believe that in some cases, they are more intimately qualified to do this kind of work than somebody who's an orthopedic surgeon who may, breeze in and do a light residency on the ankle. And many of them, especially graduating today, are qualified to do total ankle replacement. So I would like to make sure that this conversation between the orthopedics and the podiatric doctors continues, especially, and I'm going to just say this one more time, in my particular area, we have a serious access to care issue in Eastern Connecticut, where a podiatrist working at L&M Hospital is not allowed to perform certain surgeries. But if that patient goes to Westerly, Rhode Island, 15 minutes away, they can perform the surgery. And that is a real issue for my Medicaid patients in Eastern Connecticut. And that's why I feel so strongly that this bill needs to continue to have a conversation as it moves through. So I'm going to support this today with the understanding that this will continue, and hopefully we will get a compromise, because the two parties are continuing to discuss how we can make this work, and we will see final language in the future. So thank you, Madam Chair.
Thank you, Senator Summers. You hear me say often that we will continue the conversation, and that is for certain in this case. And again, with thanks to all those who have remained in conversation. Representative Claridis Detria.
Thank you, Madam Chair. And to echo Senator Summers, I do think, one, this is an access issue. For some of you may or may not know, 44 other states do allow this. I think this is a semi-compromise. I think there's much more compromise that can be done with this. I do think podiatrists should be able to do total ankle replacements, and I think that's been discussed multiple times across many different venues. And I think with this being a work in progress, to hopefully get that in there for the podiatrists to help our constituents, to help the people that need it the most. There's more than enough work. Podiatrists are more than enough well-trained, and they will do this in their residency. And moving forward, I hope we can get this across the finish line. Thank you, Madam Chair.
Thank you, Representative Claridis Detria. Senator Gordon.
Thank you, Madam Chairwoman. And I just want to point out, and I'm not trying to make any disagreement, but we did hear from our orthopedic colleagues that there isn't as much of an access issue as we've been hearing from from the podiatrists. So I think there's some difference of opinion with regards to that where you are in the state. But I do welcome that we can try to move this forward for now for the Chopars joint. And I know that we'll need to clarify some wording about that, but also to see what can we do moving forward to have further discussion. Ideally, that discussion should be with the folks that do this work medically, the podiatrists and the orthopedic surgeons. I know they have been talking, and I look forward to them continuing to talk. And hopefully there can be some sort of consensus about what can be done working together to take care of people all throughout the state who need various types of foot care, foot surgery. So I'll support the bill for now and look forward to see what we can do more working with them. But I think that the onus is very much on them to continue to work and to talk. So I welcome that.
Thank you for that, Senator Gordon. Is there further discussion on this item? Seeing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Summers votes yes.
Representative Claridis Detria,
Claridis Detria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Burger Givallo votes yes.
Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Jengo, Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kidd, Representative Kennedy, Representative Linehan,
Linehan votes yes. Sorry. Linehan, yes. Thank you.
Representative Morrow, Representative McCarthy, Representative Palm, Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman.
Senator Rahman votes yes.
Senator Rahman, I did not see you on screen, please. Senator Rahman,
Senator Rahman votes yes.
thank you. Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slack votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
thank you, Madam Chair.
Madam Administrator, we have someone else here in the room who would like to vote.
Representative Mara votes yes. Thank you.
Thank you.
We wanted to make sure that Representative Mara's vote was recorded. I was not listening well enough. Thank you very much, Madam Administrator. Moving on to the next item on our agenda. Item number 6, House Bill number 5198, an act concerning telehealth. This is a JFS to the floor, LCO 2597. May I have a motion?
So move.
Moved by Senator Anwar.
Second.
Seconded by Senator Summers. The telehealth bill is arguably the most important bill that this committee will pass this session. The current language, which were special acts during COVID, or pieces that we put in place during COVID, we are now, and they sunset at the end of June. With this S language, after hearing testimony from so many people, we are looking to, rather than as in the original bill, extend it by 3 years, to make permanent the provisions that were enacted in 2021 and 2022 that were set to sunset. The one change that is made is that a DPH, a Department of Public Health order, is no longer required for out-of-state providers, but the department would have the ability to revoke privileges for those providers who are listed again in the changes that we made in 2021 and 2022. Is there discussion on this item? Senator Anwar, to be followed by Representative Clara Destetria.
Thank you so much, Madam Co-Chair. Madam Co-Chair, we had the opportunity to listen to a number of different clinicians who actually are heavily dependent. Their patient population is heavily dependent on telehealth. I think many of the issues that they had talked about was they wanted parity, they want voice-only option, and they also did not want a sunset. And we've covered those aspects. Now, there are a number of other issues that people have had concerns about, so we may be able to further modify this going forward, but this does bring us to almost 95% of where we want to. And I'm glad that we are addressing this. And this is somewhat of a priority, like you have stated, that we want to pass this out of the committee and perhaps take it up sooner because people are looking at their appointments for telehealth. And until we pass this law, we will not be able to continue those appointments. And we want to make sure that we move this out of the committee and then subsequently on to the House and the Senate. So thank you, Madam Chair.
Thank you, Senator Anwar, and thank you for highlighting that. I know the Hospital Association had also looked at the timeline piece as well as people plan for their care. Representative Clara DeStitria, I believe to be followed by Senator Gordon.
Thank you, Madam Chair. And we all know that maybe the two positive things that came out of COVID was our ability to do Zoom and pushing telehealth forward a little bit faster than we anticipated, but all things that are very important. And we know how vital telehealth is to the healthcare community and to the residents of the state of Connecticut. Madam Chair, can you just clarify in the bill, it states that it allows out-of-state providers to practice telehealth in Connecticut under certain conditions. Can you just clarify that for our virtual people out there?
Thank you. Namely that they are properly licensed and not sanctioned within their state licensure process.
Thank you for the clarification, Madam Chair.
Thank you, Representative. Senator Gordon.
Thank you, Madam Chairwoman. And I do agree that telehealth does have its role, but there's also times that it doesn't, that you actually have to see somebody in person and examine them and talk with them. So I know our healthcare professionals make those decisions case by case, but I do agree we should be not only extending telehealth, but making it permanent, because why come back in 5 years and extend it again? But I do have some serious concerns about the JFS, so I look forward to seeing what we can do to clarify. One is that if the folks who are doing telehealth outside of Connecticut, or they're located outside of Connecticut, but they're providing care in Connecticut, how exactly would they either be licensed or registered? For example, in some other states, if I wanted to do telehealth, then I have to have some sort of registration process to make certain that there's a certain degree of oversight, and also making certain that we're knowing who's doing what, separate from what they are licensed in their own state. So we just wanted to make certain we're clarifying things with regards to making certain we have proper oversight on the quality and timeliness of care that any person, any of our citizens in this state get, especially if it's telehealth. And the other concern I just want to raise is, I believe there's a bill in the insurance committee that's talking about expanding what's considered network adequacy to allow health to be considered for network adequacy. So if we extend or allow permanently telehealth, we need to be careful how then another committee deals with network adequacy, because we don't want network adequacy to mean you have tons of telehealth doctors sitting, say, in Wisconsin, and there's more of them than there are doctors actually here, or other healthcare professionals actually here in Connecticut providing the hands-on care. So we just want to make certain we're aware of that. I know that's another committee, but it does dovetail with telehealth, and we just need to make certain we address those concerns. Thank you.
Senator Gordon, thank you for that. Oh, Senator Anwar.
Thank you so much, Madam Co-Chair. I just wanted to add a couple of comments. I think it's worthy to just touch on them. There are now corporations and larger healthcare systems which are trying to go into grocery stores or other places to try and have a telehealth only primary care. This is not the intention of this bill. While this can be used for those areas, telehealth can never replace in-person visit. To have entire care through telehealth is not safe. It is supposed to allow individuals with access issues to be able to get some of those, but I think it's worthy to highlight that we want to make sure there's use, but there is going to be somebody who may try to abuse it, and it's something that we need to keep in the back of our mind. And for the out-of-state clinicians coming into the state of Connecticut, the DPH is also still involved in the picture. So it's not like a blank check that has been written for people outside of the state. That can potentially be firmed up, maybe this session or the next, but I think it's worthy to just mention that here too. So thank you so much, Madam Chair.
Thank you, Senator Anwar. And I will also add in terms of licensure is required here as well. Is there further discussion? Representative Reddington Hughes.
Just a quick question, having to do with out-of-state telehealth. Are those taxes paid to the state in which the provider exists, or the service taxed as to the state where it was performed?
Representative Reddington Hughes, if you could help me understand your question, are you talking about fees, licensure fees, or
No, I'm
tax?
talking about a patient. So if the patient resides in Connecticut, the telehealth person is in Wisconsin. Is the state of Connecticut paid the taxes on that, or is it the tax that the patient is paying, or do those taxes go to the state in which the provider resides?
I don't believe there's a tax issue. I think it's
No.
more a fee and payment for services. So the payment for services would go to the provider where they were located. I don't know if I'm
Okay, so
answering your
there are
question
no
correctly.
taxes involved in any of the medical care then?
If you're talking about income tax for a provider, that would be within their own state. I'm not sure if that's the situation that you're thinking about.
Yes, I was thinking, where so it would just go to the state where the doctor is.
If I understand correctly, it's for tax filing purposes, is the provider's location and the payment of income taxes to the state where they are living and located
Correct.
versus the state where they are practicing.
Yeah.
And I thank you for bearing with me and helping me to clarify your question. And I would need to confirm. I know my understanding is they would certainly pay the tax in their own state. I don't know for certain if there would be any tax implication, and I would have to confirm that answer for you.
Okay, thank you.
Is there further discussion on
If
this?
there's no further discussion, I would ask that this be added to the consent calendar.
Thank you, Senator Summers. And is there objection? This item has been moved for consent. Is there objection? Seeing and hearing no objection, item number 6 will be on consent. Speaking of consent, I would actually like to take us back for a moment to item number 3, which is Senate Bill number 274. This had been moved for the consent calendar. I believe that there is objection and a desire for discussion, and the chair will recognize Representative Linehan.
Thank you very much, Madam Chair. And thank you for giving me this time. I do apologize that I arrived to the meeting a few minutes late. I just wanted to bring our attention to lines 60 and 61 of this legislation, which specifically points to safety planning supports for children. Safety planning for children is something that is within the Department of Children and Families. As we know, we have had a lot of unfortunate deaths related to opioids of young children. The Committee on Children, of which I am a co-chair, we have been consistently looking at these family planning supports, these safety plans, and we are consistently updating legislation to ensure that children remain safe in the home, whether or not they are DCF involved. So the fact that there is no member of the Committee on Children anywhere in this language that would sit on this council, it really just shows this gaping hole. And I think what would happen, unfortunately, is that we could pass legislation that doesn't work with whatever this council is finding, and vice versa. So I think it's really important to have someone on there. And without that happening, it's not that I don't support it. I think that this is very important, but we are missing a crucial member, and the role of the Committee on Children is within this purview. So I'm actually going to ask that it not be placed on consent. I'm going to vote no to flag it, and I do hope that that the chairs can work with the co-chairs of the Committee on Children to ensure that there's proper placement on that.
Thank you, Representative. And as always, this is a committee that continues the conversation. So we're happy to speak with the members of the Children's Committee, the leadership, you and Senator Mar. Is there any further discussion on this item? This is item number 3, Senate Bill number 274, an act concerning opioids. And Madam Administrator, I would ask that you kindly call the roll.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Summers votes yes.
Representative Tiredis Teacher,
Claritas Teacher votes yes.
Representative Belton,
Belton votes yes.
Representative Berger Givallo, Senator Cabrera, Representative Carpino, Representative Cook, Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Jengo, Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Representative Cabras DeGraw,
Cabros DeGraw votes yes.
Representative Kitt, Representative Kennedy, Representative Linehan,
Linehan respectfully votes no.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy, Representative Palm, Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Yes.
Senator Slack,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Wielander, Representative Zupkis.
Zupkis votes yes.
Thank you. Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item number 7 on our agenda, House Bill number 5291, an act concerning the Department of Public Health's recommendations regarding improved opioid monitoring. This is a JFS to the floor, LCO 2843. May I have a motion?
So moved.
Moved by Senator Summers and seconded by Senator Anwar. This bill allows or requires hospitals to do a toxicology screen with consent for non-fatal overdoses. This is a surveillance tool and not being used for diagnostic purposes. The S language puts an end date on that requirement to coincide with the federal funding, and it also adds a reporting requirement. I want to thank the department for bringing forward this effort to continue to address this epidemic that is killing so many of our residents. Is there discussion on this item? I see Representative Claritas Tetria to be followed by Representative Zupkis and then Senator Gordon.
Thank you, Madam Chair. Just for some clarification, in the bill, it states that hospitals that are not able to perform their testing on campus can send it out to the Department of Public Health to be analyzed. But if they do it on campus, is the hospital responsible for, will they get reimbursed?
Thank you for the question, Representative. My understanding is that this is covered by the grant, and that is one of the reasons why we changed the federal funding. That's one of the reasons why we changed the date. I will confirm that for you as well.
Thank you, Madam Chair.
Representative Zupkis.
Thank you, Madam Chair. Just two quick questions for clarification, just to make sure. When this information is gathered, the patient's identity will not be put forth. That will be still hidden information.
That is correct. There will be confidentiality.
Okay, and my second question is, if it is a child, a minor, underage, it does require parental consent.
That is my understanding, Representative Zupkis.
Thank you, Madam Chair.
Thank you, Representative. Senator Gordon.
Thank you, Madam Chairwoman. And one point I do want to highlight is, quote, if medically appropriate, end quote. So that way it's not going to be doing screening if it's felt not to be medically appropriate. And it does still leave the decision-making up to the healthcare professionals in these types of situations if a toxicology screen is needed. But if it is needed and there's consent and it's done, then there's the de-identified reporting to try to make certain there's no patient information. So I do support the bill as written. Thank you.
Thank you, Senator Gordon. Is there further discussion on this item? Seeing and hearing none? Oh,
Okay, I
Senator
would like
Summers.
to ask that this be added to the consent calendar.
Thank you. The request has been made to add item 7 to our consent calendar. Is there objection? Is there objection? Seeing and hearing none, item number 7 will be added to our consent calendar. Thank you, Senator Summers. Moving on to item number 8, which is House Bill number 5292. This is an act concerning the Department of Developmental Services recommendations regarding community companion homes. This is a JFS to the floor, LCO 2842. May I have a motion?
So move.
Moved by Senator Anwar and seconded by Senator Summers. This bill would allow the Department of Developmental Services to share information with certain entities if a group home or community companion home license was suspended or revoked due to substantiated abuse or neglect. The S language that we have before us today was a requested addition by the Department of Children and Families in lines 104 and 105 to add the notification in the licensure and certification process. Is there discussion on this item? Senator
Seeing none,
Summers.
I'd like to request this be added to the consent calendar.
The request has been made to add this item to the consent calendar. Is there objection? Is there objection? Seeing and hearing none, item number 8 will be added to our consent calendar. Moving on to item number 9, House Bill number 5293, an act concerning the Department of Developmental Services recommendations regarding various revisions to developmental services statutes. This is a JFS to the floor, LCO 2873. Is there a motion? Moved by Senator Summers. Is there seconded by Representative Claridis Tetria? This bill makes a number of various revisions, including the establishment of an oral health and dental services unit within the Department of Developmental Services Health and Clinical Services. It codifies a human rights committee and program review committee within each DDS region and Southbury Training School. It makes information in the DDS Abuse and Neglect Registry available to the Office of Labor Relations and revises a supportive housing grant to shift the responsibility and the funding from DDS to DOH, which they support, and expands eligible entities, among a couple other changes. The S language for this makes a couple of technical changes to lines 85 to 88, 336 in section 8, and in a couple other changes in section 8 and section 3. Mostly technical changes, clarifying, and changes in a timing of a hearing. Is there discussion on this item?
Seeing none, I ask that this be added to the consent calendar.
Senator Summers, the request has been made to add this item to the consent calendar. Is there objection? Is there objection? Seeing and hearing no objection, item number 9 will be added to our consent calendar. Moving on to item 10, House Bill number 5317. This is an act requiring a study concerning the funding for and effectiveness of the Community Gun Violence Intervention and Prevention Program. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar and seconded by Representative Ryan. This bill would require OPM, the Department of Revenue Services, and the Department of Public Health to study funding sustainability for gun violence prevention, as well as the effectiveness of gun violence prevention programs. And I would add that we did hear some testimony, and I imagine will remain in conversation in terms of the placement of such study. And I see that there's discussion. Representative DeSupkis.
Thank you, Madam Chair. Just a question. When we heard this bill, many of the people that testified talked about funding it through a tax on ammunition. So I would like to know, is this going to be a tax on ammunition?
This bill is simply a study. So the point of the bill is to actually have a conversation about how we can provide sustainable funding. As we saw in the Department of Public Health testimony, we have used ARPA dollars to do some of this work. We know that those dollars are not permanent. The goal is to look at a long-term sustainable solution. Certainly, there were a number of people who did testify as to an ammunition tax and their hope that that would be the way that this would go. But this discussion would certainly not be limited to just one area. This needs to be a comprehensive look at how we sustainably fund gun violence prevention, which is another epidemic in our communities.
Thank you. And I agree, in our inner city underserved communities, gun violence is horrible, and there needs to be something to be done about it. I think there are other factors also that should be studied along with it. And I just, for the record, want to remind everybody, when we voted on this to become gun violence to become a public health crisis a year or 2 years ago, there was a gentleman from an inner city who said he was shot a few times. And when asked what would make a difference, he said to have people go into the community and talk about guns. And so I want to make sure that on this study, there are people from all sides of the issue at the table. And also, if I could find this gentleman's name, he would be a great person to have on the committee, because he's on the ground and in it and knows much more about it than probably any of us do, because he lives it every single day. So thank you.
Thank you, Representative Zupkis. Gun violence certainly impacts every community in our state. It impacts in our urban centers. It impacts in our rural communities. It impacts in our suburban communities. And we certainly see gun violence related to suicide as well. Senator Marks.
Thank you, Chair. You just said exactly what I was going to say, that gun violence is in all of our communities, not just our inner cities, and death by suicide with a gun doesn't matter what community you're in. So thank you for letting me say that.
Thank you, Senator Marks. And I would add, in terms of who makes up the group, I think that's part of some of the ongoing conversation to have, because there is an existing body led by our Commissioner of Public Health. And we did see in testimony some requests that this study be within their purview. So I think that's part of the conversation that we will need to have, since that is an already duly appointed body. Senator Summers, to be followed by Senator Gordon, and then back to Representative Zupkis.
Yes, thank you. I wanted to just speak on this for a minute, that first of all, I did hear the folks also who came to testify who were coming up with ideas on how to fund this going forward. And I think that that's not really a conversation for the Public Health Committee. That's a different conversation for another body to figure out, how to fund it. This is what the level of funding should be. And my focus really is on how effective what we're doing now is working. I do not want to continue to spend money or dollars or taxpayer dollars in something that is not working. So I want to make sure that this committee really focuses on the effectiveness of what we're doing and looks at an analysis as to what we have put forward and to see the impact if it is working and not just continuing to fund something that isn't working. And I do think that we need to look at the makeup of the committee to ensure that all different opinions are at the table. And I do agree that gun violence touches every community, every socioeconomic background, and is something that, needs to be addressed appropriately with all of the different viewpoints at the table. So I'm looking forward to having this language be expanded or moved forward as we get to the final bill. Thank you.
Thank you, Senator Summers. Senator Gordon.
Thank you, Madam Chairwoman. And I do agree that violence using firearms certainly is a problem in many different parts of our state, just not the cities or the inner cities. I too share a concern that the folks looking into this for funding have certain predetermined viewpoints that I think are concerning. We've heard about an ammunition tax and other things that might limit law-abiding citizens exercising their constitutional right to legally have a firearm and ammunition with that. So I am concerned, and I would want to make certain that there is a fair and balanced group that looks at this in an unbiased and impartial way. And I hope that if there's further wording on this bill that comes out, we can see what we can do to really clarify that. Otherwise, I do have some serious concerns, and I've been hearing from a lot of my constituents in my part of the state who have raised similar concerns to me about the makeup of this group or this task force and what exactly it's looking to do vis-a-vis funding. So I wanted to highlight that point as well. Thank you.
Thank you, Senator. Representative Zupkis for the second time.
Thank you, Madam Chair. And I certainly know that there is gun violence, and I did not mean that with any, less concern for it anywhere. I will say every time I pick up the Waterbury Republican, it is gun violence and someone getting shot and drugs and guns. So please, that was with all due respect. I do not ever think that anybody that commits suicide or any of that is acceptable. And I understand it does reach across. But every time I read the paper, it is in Waterbury. So that was just my point. It was not without respect for everyone else. Thank you.
Thank you, Representative Zupkis. And I think Senator Summers raised, and I know that our current group that is addressing this issue is looking at evidence-based practices and looking at data to assure that we are directing our solutions in the ways that we are most effective in order to be able to save lives. So seeing and hearing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Summers votes yes.
Representative Clarice Detrier,
Clarice Detrier votes no.
Representative Belton,
Belton votes yes.
Representative Berger Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django, Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt, Representative Linehan,
Linehan votes yes.
Representative Kennedy, Representative Morrow,
Representative Mara votes no.
Representative McCarthy, Representative Palm, Representative Perrello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Senator, I did not see you on screen, please. Senator
Sen-
Rahman,
Senator Rahman votes yes.
thank you. Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slav votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Welander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkis votes no in hopes that a lot of these things will be worked out.
thank you. Thank you, Madam Chair.
Thank you, Madam Administrator, and a reminder that votes will be held open today until 3 p.m. Moving on to item 11, House Bill number 5320, an act concerning hospital financial assistance. This is a JFS to the floor, LCO 2868. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second? Is there a second?
Second.
By Representative Ryan. Thank you, Representative Ryan. This bill would require hospitals to provide financial assistance to patients who are enrolled in certain federal nutrition programs. It would require a universal application. It would add information that the hospitals must annually report to the Office of Health Strategy and require that hospitals make available a one-page plain language summary to groups in other languages, folks speaking other languages, if there are at least 5% of the population of the hospital service area, and require hospitals to train their staff regarding the financial assistance programs. We know that medical debt is such a crushing blow to so many families. Is there discussion on this item? Senator Gordon.
Thank you, Madam Chairwoman. One question I have for clarification is if reporting is going to OHS, is OHS able with its current staffing to handle this and with whatever it has for funds to be able to handle this reporting? Since we wouldn't want the reporting just to be reporting for the sake of reporting.
I would not speak for OHS, but I will say, Senator, that we, committee leadership, I believe, has a meeting set with them later this week. So I believe we will be discussing that with them at that point in time.
Thank you, and I look forward to hearing about that. And since that's a major concern I have, what can they handle and what they're capable of doing in this regard? Thank you.
Thank you, Senator Gordon. Representative Clara DeStitria.
Thank you, Madam Chair. Can you just give us some clarification for the substitute language, why that was removed?
Thank you, Representative Clara DeStitria. I forgot to add that in my remarks. And the S language actually removes the Attorney General's role in investigation. So the decision was made to not take that step at this time. Thank you for asking the question.
Thank you, Madam Chair. And with the removal of that section, I believe that makes this bill unenforceable. Is that correct, Madam Chair?
There is not an enforcement mechanism that would be specifically part of this bill, as is, I think, often the case with some of our legislation.
Thank you, Madam Chair.
Thank you for that, Representative Clara DeStitria. Is there further discussion on this item? Seeing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Summers votes no.
Representative Clara DeStitria,
Clara DeStitria votes no.
Representative Belton,
Felton votes yes.
Representative Burger Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Django, are you in the room?
Yes. I vote yes.
Thank you. Representative Gilchrist, Senator Gordon,
Senator Gordon votes no, but looks forward to hearing from OHS.
Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kidd, Representative Kennedy, Representative Linehan, Representative
Linehan
Moore.
votes, Madam, I'm sorry for the delay. Linehan votes yes.
Thank you.
Thank you.
Representative Morrow,
Representative Mara votes no.
Representative McCarthy, Representative Palm, Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Senator Rahman, I did not see you on screen, please.
I don't know, I haven't.
I am seeing you now. How would you like to vote?
Senator Rahman votes yes.
Thank you. Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slack,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes no.
Representative Terciat,
Representative Terciat votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis.
Zupkis votes no.
Thank you. Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item number 12 on our agenda. This is House Bill number 5321, an act requiring newborn screening for Duchenne muscular dystrophy, JFS to the floor, LCO 2869. May I have a motion?
So move.
Moved by Representative Cook and seconded by Senator Anwar. This bill has S language, which simply changes the date to 2027. And the bill is simply as its title describes. It adds this screening to our standard newborn screening. Is there discussion on this item? Representative Cook, to be followed by Representative Mara.
Thank you, Madam Chairman. And could you just explain what the reason was for the extensive pushback on the date, please?
Thank you, Representative Cook. I don't know if I would characterize it as extensive pushback. I think we had added last year through this committee cytomegalovirus, and there was some thought to see how that process played out to then allow for that stepped process for an additional screening.
So my understanding, though, that you would be able to take blood work and then just use that same draw to screen for whatever different types of viruses or diseases that you're looking for. So that's why I use the extreme word, because I mean, 2027 is a distance away. We're not even all the way, halfway through 2024. And so if it was a concern, I could see 2025 or maybe 2026, but 2027 seems like a long time, especially knowing that we have children that will be suffering from this tomorrow.
Understood. Thank you, Representative Cook. I think it was to be following. I think we have a process still going with cytomegalovirus, but your point is very well taken. And I appreciate that. And I am grateful that we're having the conversation. Representative Mara.
Thank you so much, Madam Chair. And I really just want to thank the committee and the chairs and the leadership for taking this on. I I really appreciate your all's dedication to this. And I think as we look forward to the medical community coming up with new treatments for medicines, I think it's important that we be nimble and flexible when it comes to screening for them, because we are constantly having new treatments out there that are available for our community. So just really want to thank the committee for taking this on.
Thank you, Representative Mara. Is there further discussion on this item?
Seeing none, I'd like to ask that this be added to the consent calendar.
Senator Summers has requested move to consent. Is there objection? Is there objection? Seeing and hearing none, item number 12 will be added to our consent calendar. Next on the agenda is item 13, House Bill number 5322, an act concerning the distribution of educational materials regarding intimate partner violence toward pregnant and postpartum patients. This is a JFS to the floor, LCO 2865. May I have a motion?
So move.
Moved by Senator Anwar and seconded by Representative Cook. This bill's S language simply adds birthing centers to the language, and it requires the DPH Maternal Mortality Review Committee, with, we know, the support of one of the members. We know CCADV has been a great champion and involved in this, and we're grateful to them for their leadership to help develop educational materials on intimate partner violence, and requiring that the Department of Public Health would distribute those materials in print to our birthing hospitals and now birth centers in the S language. Is there discussion on this item? Senator Gordon.
Thank you, Madam Chairwoman. I just have a question for clarification. Have we heard from the Maternal Mortality Review Committee that this is something that they're able to handle? I may have missed it in testimony on this bill.
Thank you, Senator Gordon, for the question. And actually, it was very late in the evening that we did hear from a member of and a leader of the Maternal Mortality Review Committee, and in discussion. And it's one of the reasons why I specifically mentioned CCADV, because they are intimately involved in, pun intended, in this effort, and have expressed willingness to help us make sure that there is capacity to get that done. Is there further discussion on this item? Senator Summers.
If there's no further discussion, I ask that this be added to the consent calendar.
The request has been made to add this to consent. Is there objection? Is there objection? Seeing and hearing no objection, item number 13 will be added to our consent calendar. And that now does bring us to our consent calendar. Our consent calendar includes, we've already had a motion and a second for that consent calendar. It includes item number 1, Senate Bill number 175. Item number 6, House Bill number 5198. Item number 7, House Bill 5291. Item number 8, House Bill 5292. Item 9, House Bill 5293. Item 12, House Bill 5321. And item 13, House Bill number 5322. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner, Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers.
Representative Parker votes yes.
Thank you, Representative.
Thanks, Beth.
Senator Summers,
Senator Summers votes yes.
Representative Clarice Dietrich,
Representative Clarice Dietrich votes yes.
Representative Belton,
Belton votes yes.
Representative Belton, I did not see you on screen, please.
Belton votes yes.
Thank you. Representative Berger Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Denning, are you in the room?
Yeah, I'm on screen.
Thank you. I see you now. Thanks for your vote.
Thank
Representative Elliott, Representative Django,
Representative Jenga votes yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kidd, Representative Kennedy, Representative Lenahan,
Linehan votes yes.
Representative Morrow,
Representative Mara votes yes.
Representative McCarthy, Representative Palm,
Palm votes yes.
Representative Palm, are you in the room?
Yes, I am, ma'am.
Thank you.
Yep, thank you.
Representative Perello, Representative Rader,
Representative Rader votes yes.
Senator Rahman.
Senator Rahman votes yes. You see me? No?
See you now. Thank you.
Thank you.
Representative Reddington Hughes,
Representative Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak,
Thank you. Representative Terciak votes yes.
Representative Welander,
Representative Welander votes yes.
Representative Zupkis.
Zupkis votes yes.
Thank you. Thank you, Madam Chair.
Thank you, Madam Administrator. And before we conclude, again, votes will be held open until 3 p.m. today. A couple of announcements, just to let you know that, or remind you, we have a public hearing on Zoom and 1D on Wednesday, this Wednesday, the 13th at 11. In addition, the Public Health and Appropriations Committees will be holding a joint public hearing on the Tobacco and Health Trust Fund allocation, which we discussed earlier in this committee. That will be followed by a committee meeting on March 14th at 1:30 in 2C and via Zoom. We also have a committee meeting Friday, March 15th at 1 p.m. I would like to say thank you, as always, to our incredible team. I'm looking at all of you, both our committee team as well as our nonpartisan team, who are the reason we're able to do the work that we do here together with all of you. So thank you so much to all of you, to our wonderful leadership, our ranking members, and Senator Anwar, if you wanted to say anything before we recess, please do.
I just wanted to thank you, Madam Chair, and our ranking members. We all work very closely together, the entire group. This is one committee that each and every person is trying to do the best for the people of our state. I really enjoy working with each and every one. So thank you for the team and all the legislators. Thank you, Madam Chair. And I can see Senator Rahman.
Thank you so much. I hope you all have a wonderful day today. Thank you for your assistance.
Madam Administrator, can I vote?
We are in recess.
Madam Administrator, I'd like to vote too.
I think we're all raising hands.
I'll start with the consent calendar. Representative Zupkis, you voted on consent. Let me check to see if you're missing anything else.
Okay, maybe the first couple.
Yeah. Item number 2, Senate Bill 243. How would you like to vote, Representative Zuercher?
Yes, please.
I'm just making sure.
Thank you.
You're welcome. I think that's it for you. Everything else is on consent.
Thank you.
Thank you. Senator Slack?
Yes, just wanted to make sure. I may have missed the first couple.
Senate Bill 243.
But yes,
House Bill 5058.
yes,
Senator, you're all set.
thanks so much. Have a great day.
Thank you. Representative Steinberg?
I believe I missed one vote.
That's House Bill 5196.
I vote affirmative.
Practice. Just let me check the others for you, please.
Thank you.
You're all set, Representative Steinberg.
Thank you, Madam Administrator. Have a good day.
Thank you. Thank you. Representative Parker, am I missing you on something?
Hey, Bev, I think just the first vote.
Senate Bill 243.
Yes, Representative Parker votes yes.
Thank you.
Thank you, Bev. Nice to see everybody.
Representative Carpino, how are you?
I'm good, Bev. I have the agenda in front of me.
Okay, I'm going to line the bills up. Can we vote on consent first?
Yes.
Item number 1 is on consent.
Yes.
Item number 6. Item number 7. Item number 8, 9. Item 12 and 13. How would you like to vote?
Yes.
Item 2, Senate Bill 274. How would you like to vote?
Yes.
Okay, my folders. Item number 5, how would you like to vote?
Yes.
Item number 10, House
No.
Bill 5317. How would you like to vote?
No.
Thank you. Item number 4, House Bill 5058, Representative Carpino.
Yes.
Senate Bill 243, item number 2.
Yes.
House Bill 5320.
I'd like to vote no.
Let me just double check to make sure I get through everything. You're all set, thank you.
Thank you.
Representative Linehan.
Hi, Bev. I think I may have missed a vote on item number 2.
You didn't miss number 2.
I didn't.
No.
Oh, then I need to work on my memory, ma'am. I am all set. Thank you very much.
Just hold a minute, please.
Oh, okay.
You're all set.
Great. Thank you so much. Have a great day.
Didn't know how it would work in the room. Like, where are we all have our hands up? I was like, well, but I'm here.
Please give me a few minutes, please. Representative Morris, she wants to, yeah. Yes, go with me, please.
And the other one is, oh, what's
Making sure we can. Fine, okay. All right, how would you like to vote on SB 243?
I will vote yes on SB 243.
Okay, you're all set. Hello? Can you guys hear me? Just making sure. We have a yes? Okay. All right.
Can you
so-
hear me?
Yeah, so I'll be taking Representative Denning first.
Sure.
Are you ready to vote, Representative Denning?
Yes,
Oh, you're-
I am.
Okay.
Yes.
So I have missing you for number 2, SB number 243.
I vote yes.
Yes. Item number 3, 274.
I vote yes.
Item number 4, 5058.
I vote yes.
Okay. Item number 10, HB number 5317.
I vote yes.
Okay. And then HB number 5320, number 11.
I vote yes. I thought I was I thought I was here.
I do have you for that.
Okay, the one that I don't know that I voted for was 5196, number 5.
Let me just make sure.
Okay, because I missed the early ones.
Yeah, I do need you for 5196. So
5196, I vote no.
okay.
And you have me down for 5058?
Yeah, you just voted yes.
Okay, very good.
Mhm,
That yeah, I
yourself.
want to make sure I got that one. Otherwise, thank you very much, Peter.
Yeah, no problem. All right. And next, I'll take Representative Kit.
Yes, hi.
All right, for SB number 243.
Yes.
Yes. SB number 274.
Yes.
Yes. HB number 5058.
Yes.
Yes. HB 5196.
Yes.
And HB 5317.
Yes.
HB 5320.
Yes.
And the rest were consent, so you're all good.
Yes.
Okay. Next, I'll take Representative Calvin Figueroa.
Thank you.
Thanks,
so much.
Peter.
Somehow I was the first hand out, but I've now waited for 10 people. So I don't really get that. I think it was number 3 that I missed, because I think 2 went on consent.
Number 3 was SB number 274.
Yes, and my vote is yes.
Okay. Okay. I'm just making sure I've got you for the rest. For HB 5058, how do you like to vote?
Yes.
Okay. It seems like you're all set, Representative.
Okay, thank you so much. Have a great day.
Yeah, you too. Next I'll take Senator Rahman. Oh, okay, I'll take you, Representative Daphne, next if Representative. Oh,
Sorry, I think I missed you.
no, you're good.
I don't know, I missed any vote or?
I'll check right now.
Sure.
It seems like you're all set, Senator.
Okay, awesome. Thank you.
Yeah. Representative Daphne, I'm finally ready to take you. Oh, you're muted. If you're having issues, you can come up to room 3000. I can take your vote in person. Room 3000, it's on the third floor, first right. I'm trying
I got it. I got it. I got it.
Okay.
I'm on my phone, so it's a little more complicated. So go ahead. I'm sorry.
Okay. So for the roll call vote, let me just make sure I have the right seats. So item number 2, SB number 243, an act establishing an assertive community treatment pilot program for home health agencies. How would you like to vote?
That one's a no.
No. Item number 3, SB number 274, an act concerning opioids.
I'm a yes.
Item number 4, HB number 5058, an act adopting the nurse licensure compact.
I'm a yes.
HB.
I'm sorry. Oh, go ahead. Sorry.
Item number 5, HB number 5196, an act expanding the pediatric scope of practice.
Yes.
Okay. Item number 10, HB number 5317, an act requiring a study concerning the funding for and effectiveness of the Community Gun Violence Intervention and Prevention Program.
I'm a no.
And then item number 11, HB number 5320, an act concerning hospital financial assistance.
I'm a no.
Okay, and the rest were on consent.
Yes, I'm a yes.
Okay, all right, have your thought. Great, you're all set. You're all set.
Thank you. Thank you so much.
Have a good day.
Weirdly, I can't hear you. Can you hear me?
Your camera's not moving. Let me just. Oh.
Can you hear me?
Oh, I can hear you now.
Okay.
All right. So I'll just take your votes now. Okay. For items, for item number 2, SB number 243, that was a roll call. How would you like to vote?
So 243, you said?
Yeah. Item number 2.
Yes.
Item number 3, SB number 274.
Yes.
Item number 4, HB number 5058.
Yes.
Item number 5, HB number 5196.
Yes.
Item number 10, HB number 5317.
Yes.
And then item number 10, HB number 5, oh, sorry, number 11, HB number 5320.
Yes.
And the rest were all on the consent calendar.
Okay, and I vote yes on consent.
Okay, hey, we got you. You're all set.
All right, thanks. Have a good one.
You too. Bye.
Bye.
Mr. Clerk or Madam Clerk?
Hi.
Hi,
Yeah.
I'm jumping between meetings today.
Okay. Have you previously voted on all of them?
I know that I missed a couple.
Okay, I'll just go over. I'm missing you for 274. How would you like to vote? Let me just make sure.
I would like to vote yes, please.
Okay. Yep, you're all set.
That was it?
I didn't have you for that one.
Awesome. Thank you so much. Have a good one.
You too, bye.
Bye.
Hi, Senator Kushner. I'll be with you in 1 minute. No, it's okay.
Did I enter?
Mhm. For
SB 243.
Yeah, how would you like to vote?
I think I'm a yes.
Hello, Representative McCarty.
SB number 274.
274, I'm a yes.
HB 5058.
Yes.
HB 5196.
I think I'm a yes. They're gonna price it out.
Yes.
But no.
HB 5317.
Oh, yeah, yes on that.
And then HB 5320.
I think I'm no on
Okay, and the rest were on consent.
that. Okay.
Right.
Sure, that wasn't as far as I could do. Well, I like to have my notes.
Representative.
Of my memory, but.
Representative McCarty.
Have a good day.
You can't hear you. I apologize. I have the AirPod in.
I was trying to say hello. Tell her.
He
I
said
hello.
hi. He said hi. Okay.
I'm ready to-
I'm ready to take you now, Senator. Okay. For item number 2, SB number 243, how do you like to vote?
Yes.
Item number 3, SB number 274.
Yes.
Item number 4, HB number 5058.
Yes.
Item number 5, HB number 5196.
Yes.
Item number 10, HB number 5317.
Yes.
And then item number 11, HB number 5320.
Yes.
And the rest were on consent.
Thank you.
All right.
Bye-bye.
Yeah, but have a good day. It seems like you're muted, Senator or Representative DiCaprio. Let's see. Oh. No, I still can't hear you.
Oh.
Oh, I hear you now. I
Okay,
hear
good.
you. Okay. Are you ready?
I'm ready.
So we had a roll call on SB number 243, item number 2.
Okay. So that, I'm gonna be a no on that one.
Okay. Item number 3 is next, SB number 274.
It was a roll call on that one?
Yeah, an act concerning opioids. Mm-hmm.
Okay. So, oh boy. I'm gonna be a no on that one too.
To be clear on item number 4, SB number 274, you're a no?
Okay.
Okay. Item number 4 is next, HB number 5058, an act adopting the nurse licensure compact.
I'll be a yes on that.
HB number 5196, an act expanding the pediatric scope of practice.
I'll be a yes on that one.
Item number 10, HB number 5317.
I'm gonna be a no on number 10.
Okay. And then for number 11, HB number 5320.
Okay. That's a no also.
And the rest were on consent.
The rest are on consent. Okay.
Yes.
So I'll go back to the beginning of my list here. And start, I think, number 1, right?
Yes, I'll just read off the items. So item 1 was on the agenda. Item 6 was on the agenda. Sorry. On the consent. Item 1 was on the consent. Item 6 was on the consent. Item 7 was on the consent. Item 8 was on the consent. Item 9 was on the consent. Item 12 was.
Okay.
And then
I got 9.
Item 12 was on the consent, and then finally number 13 is on the consent.
Okay. Yay on that.
All right, you're all set.
All right. Thanks very much.
Yeah, no problem.
Okay. Bye-bye.
Representative Kennedy, I'm ready to take you. Oh, you're muted.
Okay, thank you.
I can hear you now.
How are you?
Right.
All right,
So item number 2, SB number 243, how would you like to vote?
that Kennedy votes yes.
Yeah. Item number 3, SB number 274.
Oh, okay, that wasn't consent.
No.
Okay, Kennedy votes yes.
Item number 4, HB number 5058.
Kennedy votes yes.
Item number 5, HB number 5196.
Kennedy votes yes.
Item number 10, HB number 5317.
Kennedy votes no.
And then item number 11, HB number 5320.
Kennedy votes no.
And the rest were on consent.
Correct, and Kennedy votes yes.
Okay, hey, you're all set.
That was 1, 5, 6, 7, 8, 12, 13, right?
And 9. And 9.
And 9, okay. All right, awesome, thank you.
You're all set. Have a good day.
Have a great afternoon.
Yeah, you too. Okay, we're all ready.
So yes.
Yeah. SB number 274.
Yes.
HB number 5058. Oh, well, so, yeah.
Is that all I missed?
And
On the consent too, right?
HB 5317.
5317 was, I think I was fine with that one. I just want to be sure. Oh, yes, that was a,
And then,
can I be a hell yes? on
and then HB 5320, the one after that one.
that? Yes.
And the rest were on consent. So,
All.
yeah, all right.
And everything else is consent.
Yeah,
We're
you're all
good.
good. All
Yes.
right.
Thank you, thank you, thank you.
Hi, good afternoon.
Hey, how's it going?
Okay, I can hear you. All right. For the first one, or are you ready? At least,
I'm gonna vote yes.
are you ready? Okay. For S.
Oh, I'm ready. Sorry. Yes, yes,
All right.
yes.
For item number 2, SB number 243.
Yes.
Okay. Item number 3, SB number 274.
Yes.
Item number 4, HB number 5058.
Yes.
Item number 5, HB number 5196.
Yes.
Item number 10, HB number 5317.
Yes.
And then HB number 5320, item number 11.
Yes.
And the rest were on consent.
Yes.
Okay. All right. You're all set.
Thank you.
Yeah. Have a good day.
Hey,
Oh.
Peter, how are you doing?
I am good. How are you? Okay. Are you ready?
I am.
Okay. Item number 2, SB number 243. How would you like to vote?
Yes.
Item number 3, SB number 274.
Yes.
Item number 4, HB number 5058.
Yes, and the only, just if you don't mind, the only one I'm going to be a no on, I just want to make sure I don't miss it, is the hospital.
Financial assistance.
Yes, thanks.
Okay.
You
All
could
right.
just flag that. Just honestly,
Yeah.
I don't have the agenda in front of me, so I don't have the numbers committed to memory.
Okay. All right. I'll read out the title as well. Item number 5, HB number 5196, an act expanding the pediatric scope of practice.
Yes.
Yeah. Item number 10, HB number 5317, an act requiring a study concerning the funding for and effectiveness of the Community Gun Violence Intervention and Prevention Program.
Yes.
And then item number 11, HB number 5320, an act concerning hospital financial assistance.
That's a no.
Okay. And the rest were on consent.
Got it. Thanks.
All right. Yeah, you're all set.
You too. Bye.
Have a good day. Hi, Senator Cabrera.
Hi, how are you?
I'm good. How are you?
I'm good. How many votes do we have?
We had 1, 2, 3, 4, 5, 6.
Okay.
All right, so I'll just read them to you. Item number 2, SB number 243. How would you like to vote?
Senator Cabrera votes yes.
Item number 3, SB number 274.
Senator Cabrera votes yes.
Item number 4, HB number 5058.
Senator Cabrera votes yes.
Item number 5, HB number 5196.
Senator Cabrera votes yes.
Item number 10, HB number 5317.
Senator Cabrera votes yes.
And then item number 11, HB number 5320.
Senator Cabrera votes yes.
And the rest were on consent.
Awesome. Thank you.
Yeah, you do. Bye.
Appreciate it.